welcome to Age Well with Joy. I'm Joy Paith, the CEO for AgeSmart Community Resources, and I'm here today with Chris Fulton, the Home and Community-Based Service Manager for AgeSmart. So it's open enrollment.
Yes.
For Medicare, and we are very, very busy. Our senior health insurance counselors have booked their appointments well into late November already. So we just wanted to go through some things that we think are challenges for folks and really teach you how to ask the right questions about Medicare. So the first thing, the interesting thing we've been seeing this year, there are a lot of people who are new to Medicare, so 65-year-olds, and wanted to kind of talk about what do people have to do when they're new to Medicare, Chris?
Well, when they're new to Medicare, first they have to make sure they've signed up for Medicare. If they're already receiving cash benefits, then about 3 months before they turn 65, they will get a Medicare card in the mail. If they're not already receiving benefits, they need to contact Social Security 3 months before their 65th birthday. They don't want to wait till the last minute. They want to have everything in place as much as possible by the time they turn 65. And with Medicare, everything starts on the first day of the month that you turn 65. Doesn't matter if your birthday is the 5th, the 15th, or the 30th.
Okay. So there's different kinds of Medicare. Can you tell us a little bit about the ABCs of Medicare?
ABCs of Medicare. Medicare Part A is hospitalization. It covers hospitalization, skilled care to a point, a rehab type situation, and hospice care. Medicare Part B covers doctor's office visits, durable medical equipment, lab tests, x-rays, things like that. Medicare Part C is what they call Medicare Advantage plans. It basically takes the other three parts of Medicare and rolls it up into one program. And then Medicare Part D is the prescription drug coverage.
Great. Well, I want to go back to those Advantage plans in a little bit, but do you have to take, so say you have employer coverage, what parts of Medicare do you have to take?
It depends on your employee situation. If you work for a company that's large enough, no, you don't have to take Medicare Part B. If you work for a small organization like AgeSmart, when you turn 65, you do have to take Medicare Part B, even though we have employee health coverage here on this. So you need to call your local SHIP counselor. You need to talk out your individual situation with them.
So there could be problems if you don't take it. And you need to. And what happens then?
If you do not take Medicare Part B when you are first eligible, and you should have, then you will face a 10% penalty for every year you did not take Medicare Part B when you were eligible. Now, again, that being said, if you have employee coverage and you meet the criteria, you don't have to until you retire and lose that employee coverage.
Depending on the size of your employer. That's the key. So same thing with Medicare Part D, which is prescription drug coverage. Mm-hmm. What about that?
That one's a little different. If you don't take prescription drug coverage when you're first eligible, it's a 1% penalty for every month you didn't take it when you were first eligible. And it's based off the national benchmark premium, which right now is around $30. So think of it as 3 cents per month for every month you didn't take it.
So it can be significant.
Yes, it can be significant.
And I think a lot of people aren't using prescription drugs, so they think, I don't really need it. However,
you can't just pick it up when you want it. So if it's April and you're like, the doctor's prescribed me this, you can't just walk in and say, I want to get my Medicare D now. You have to wait to the open enrollment period.
So open enrollment, why is it important to check your Part D coverage?
Things change every year. Premiums, deductibles, the drugs that each company covers change. So you want to make sure that your medications are still going to be covered the next year. The payment's still something that you can afford, and the deductible something you can afford if your plan has a deductible.
Because if you don't check January 1st,
you are stuck in your plan until next enrollment period.
Right, and that could be bad, especially if an expensive drug was dropped off your formulary. So a lot of times we hear, well, my neighbors, they have a great Part D plan, or they have this and that. Why can't you compare to your neighbors?
Because everybody is different. Everybody has a different medication list. Everybody has different health issues. If your neighbor is relatively healthy and takes 2 generic drugs, that's one thing. If you have type 2 diabetes, high cholesterol, high blood pressure, you're taking all these medications, your list of medications is 4 times as long as your neighbor's, then your Part D is going to cost differently.
So, with that being said, a lot of folks that are coming into the office and asking questions, there's not a 100% understanding of what are supplements, what are advantage plans, and what is retiree insurance. Can you talk through those three?
So they're all different. They're not interchangeable. A lot of people will come in and say, well, I have a supplement, when what they actually have is a Medicare Advantage plan. So a supplement is just that. It supplements original Medicare A and B. And there's different types of supplements. But that's basically what it does. A Medicare Advantage plan, as I said earlier, is also called a Medicare Part C, and it's a plan that combines A, B, and usually Part D, your prescription drug coverage, all in one nice, neat package on that. And then retiree insurance differs from company to company, depending on what company you worked for, what their retiree coverage is. The big thing is, if a person has retiree coverage, if they enroll in a Medicare Part D plan, and they shouldn't have, they could lose their retiree coverage and not be able to get it back. So we want to be very careful and make sure that we know exactly what a person has.
Does that go for both Part D and the or the Advantage plans?
Yeah, if they have retiree coverage and they enroll in a Medicare Advantage or a Medicare Part D plan, yes, they could lose all their coverage.
So let's talk a little bit about those Advantage plans. So on TV, we hear a lot of celebrities like Joe Namath, William Shatner, Jimmy Walker, and I think even ice skater, right? Dorothy Hamill.
Yep.
So talking about these Medicare Advantage plans and what makes them so fabulous. And we've had a lot of people come into the office wanting to switch their retiree coverage for these plans, which would not be good always, but there's some good to it and some bad. Can you talk about the good, the bad, and the ugly?
The good, the bad, and the ugly. Yeah, we do get a lot of people come in here, well, Joe Namath said. And it's like, well, Joe Namath doesn't know your situation. You're not close personal friends with Joe Namath. What they are saying in those commercials, yes, is true. If you meet the qualifications for it. Yes, you can get money back. Some plans do have what they call a payback plan, which means that they will reimburse you your Medicare Part B premium. Some people are eligible for Medicare Savings Program, which will pay their Medicare Part B premium. But these are income and asset-based programs. So you have to meet an income requirement. You have to have an asset requirement. You have to pick a company that has a payback plan. Not all of them do. They're few and far between. And what may be available in Missouri may not be available in Illinois, not available in Indiana. Each state is different on what Medicare Advantage plans are available. There's benefits in these Medicare Advantage plans. The plans put in maybe some dental and some vision and a silver sneakers program or another evidence-based exercise type program. It depends on the plan. Each plan has different extra benefits. They talk about home delivered meals. Yes, people can qualify for home delivered meals if they're available in your area. And if you meet the qualifications for home delivered meals again. So it's each individual, the plan and the person who's applying. And basically what those ads are selling are Medicare Advantage plans. And if you call the number they give you, it's not going to connect you with the federal Medicare office. It's going to connect you to their telephone line, which is going to then get you in touch with an insurance salesman who's going to try to sell you one of these plans. And if you, like you said, have a retiree plan, you may lose your retiree plan if you sign up for one of these.
So be very cautious when thinking about Medicare Advantage plans. That's probably the main thing. Don't believe everything you hear.
Talk to your local SHIP counselor.
Right. And the one thing about senior health insurance counselors, like the folks in our office, they're trained on a regular basis. They're not paid for by any insurance company. They're totally unbiased. So everything is free and confidential. So we encourage you to come by and do it quickly, because it is a busy, busy, busy time. So we talked a little bit about those. Anything else that you wanted to say about those Medicare Advantage plans?
Once again, it's like any other commercial on TV. They're trying to sell you something, and if it sounds too good to be true, it probably is.
So where can people get, besides here, their Medicare questions?
If you live in Bond, Clinton, Madison, Monroe, Randolph, St. Clair, Washington counties in Illinois, you can call our office at 618-222-2561, and we will connect you to the SHIP counselor in your community. You can also call the senior helpline through the Department on Aging at 1-800-252-8966 if you live in other areas of Illinois, and they can help connect you to your local SHIP counselor. If you don't live in the state of Illinois, you can call the national number at 877-839-2675. That is SHIP Help, and they will connect you to the local SHIP office.
Thank you. And we do a lot of assistance with benefits of all kinds, but is there any other, you kind of briefly mentioned some of the assistance to help pay those Medicare premiums?
There is the Medicare Savings Program, which has 3 levels, depending on your income and your asset, and that can help. At the highest level, can pay your Medicare Part B premium, which right now is $170 a month. That would put that money back in a person's Social Security check. And will also pay what Medicare doesn't. So the 20% Medicare doesn't pay, then the MSP program will pick up. The second tier will pay the Medicare Part B premium for them. Then there's also the limited income subsidy, or extra help for prescription drugs. And a person qualifies for that, they can get a premium-free Part D, and their copays for their medications are greatly reduced.
So don't be discouraged. There might be something out there for you, and we're in a busy corner here. So when you drive by, come on in and ask us about your Medicare coverage. But please do give us a call, and thank you, Chris. She is a wealth of knowledge, as are the other folks that work here, and we thank you once again for joining us today.